So, we've just been talking about how the examination of the abdomen and the impacts of abdominal injuries impact your casualty from thinking about approaching the patient, what mechanics of injury, and catastrophic bleeding, etc. Going on to actual, you've done the ABC, you're happy that they're breathing, the circulation's fine, they've got a good airway, and now we're actually looking beyond the sort of the disability and looking at sort of exposing and actually looking at the casualty. So a lot of people get very nervous about stripping people off. As a nurse, I spend most of my time within 2 seconds or meeting people and having their feet off and having a good rummage around. So it's something you need to sort of just be prepared to do. Casualties do expect you to get down to the skin and have a proper look. So don't be nervous. Give them a bit of shielding if you can, especially at the moment because it's cold outside. So you've got somebody who perhaps has come off the mountain bike and maybe have hit the stomach, and when you've gone through the symptoms in their sample history, been telling you that from the mechanics, you know that they've potentially sustained some injury. So you're going to expose and remove clothing so you can actually look at the abdomen. So looking at the abdomen, the patient, casualty, might actually start pointing or sort of, moaning and sort of trying to sort of guard a certain part of the body, which could give you a clue as to where there might be problems. There might be signs of bruising, there could be a cut, bits sticking out. So again, it just gives you an idea when the patient's laid down of looking at, being aware of what sort of organs are where as to what you need to do. So when it comes to actually getting your hands on you, you're happy that there's nothing sort of stabbing out of there. Well, you've got gloves on, hopefully. So it's just a matter of, don't sort of stick really hard down because you won't like that. And you can see from Ed, if you start poking like that, you don't get a very good response. So basically, I haven't got cold hands. But if you just sort of imagine, as I said before, about your abdomen being into 4 quarters, just have a little feel, just nice and gently. Obviously, Ed's pulling his tummy in at the moment because he's trying to be skinny. Some patients obviously are going to be quite sort of podgy.
Pregnant.
But yeah, but be aware, sort of just have a feel around. So just gentle feel around. If there's at any point there, sort of wincing and across, just sort of, I tend to sort of start from the middle and work out, just because it's, generally speaking, the actual sort of small intestine tends to have less nerve endings, it tends to have less pain. If you've got rib areas, if you know that someone's got rib fractures, or you're suspecting it, be aware that you could be looking for crepitus or just paradoxal movement, in which case you start thinking that might be some injury to these organs below them. Very beautifully drawn on bladder. Be aware that if someone's been bussing for a pee before an injury, sometimes they can actually rupture the bladder. So you might sort of see or get people that have got pain, or you can sort of see some reddening. People getting reddening to the skin is quite a late sign, so you're not likely to see that. Again, if you've got somebody's abdomen sort of slowly filling up with blood, you might well notice that, but it depends on how sort of skinny or fat they are, but you're not really likely to see that. More of just a case of a quick palpate round the 4 areas, see if they get a response. We can't really fix anything that's in there. If they've not got a spinal injury or neck injury, we can roll them slightly or get them to slightly move over onto the side. It would be helpful, or get people to help, and just have a look at the back. Again, if they've got a massive bruise or something at the back, such as, oh, I'm going to be sick, be aware you've got your kidneys there, and they can bleed quite a lot. And obviously, I can draw that. We do have a lot of people that have been sort of stamped by cows and things, so it's sort of a possibility that someone has protected themselves and rolled over. So that's that really for examining the abdomen. That's okay, thank you.